when it comes to football, a technical ability of the player, definitely. Technical ability, tactical understanding, which is not part of the fitness, but then their understanding of football. We make sure that the trainings are high intense, the intensity is up towards the match level or even more. We have seen so many players drop off because of one small injury in a trial class or in the beginning of the class. So parents gets worried and they don't want to continue.
Any player should understand that pain is a signal that something is wrong somewhere.
There are few players who will be feeling that resistance, who will be feeling that there is pain. But then in their head, if the team is losing or they want to fight more, they'll push really, really hard.
Before putting your players in, what is your criteria knowing that they are 100% fit? What do you look at? Today we are with the person from soccer or football, you want to call it, who has Mumbai Soccer Prodigy, and that's Ashutosh Rathod. Thank you for coming. Today we'll be discussing the most loved game in the world, which is soccer or football.
Thank you, sir, for welcoming me here. And I'm really, really glad to be here and meeting with you in person.
No doubt India plays a lot of football. We have states like Bengal, Kolkata is known for its football teams. Goa is known for the football team. Kerala is known for the football teams. But in North also, Punjab also has a football team.
Right.
I want to ask you about being from Mumbai. What made you think about football?
Oh, so it's a long story, to be very honest. It's a story of a fight between me and my, you can say, anti-hero. I was not so good at any sport, or I was not so, not too much into sport. When I was in junior college, I was bullied a lot for, getting into the team. I had no clue there was a sport called football. Somehow I thought I'll make it to the team, like you.
That's your college team. You wanted to play for your college.
It was a college team. It was Bhagubai Mafatlal when I was in that college. So I used to stay in Mulund at that point of time, and there was a club. So I used near.
Sorry. So failing in college team, you decided to join a club and play for the club in Mulund.
Yes, sir. So after failing, I realized that I should find something where I can learn football. I found a club locally, nagged the coach throughout the year that you should let me practice. He saw me once and he decided that he's really bad. He should not take me. But then which was after nagging for a year, he gave me a chance and I made it to one of his team trainings. And then I was consistent there for a couple of years. And after 2 years, first time ever, I got to play an official match. I was very patient with it because I wanted to learn. But then yes, I did. That's how my football started. And moving on to now, I have my own teams, I would say, 3 teams, 2 teams in Thane, 1 in Mumbai.
Wow.
Both the Mumbai and Thane teams are playing at the top league, and the club is pretty well known, called as Mumbai Soccer Prodigies and Thane Soccer Prodigies. Prodigies in general. So, yeah.
But I want to tell you, why should a parent send their children for soccer or football?
So, let's not talk about sport only, sir. So, one thing is where he can become a professional player, he can become an athlete, he can make a career out of it. But apart from all of these things, the player who comes on pitch is training every day. So, there is a lot of discipline that is needed. He is interacting with a group of people which is very, very dynamic. Okay, everybody is not the same. So, if you see football, people are from very rich background, very poor background are playing in one team. So, you meet different people and you understand how to deal with them. Sometimes it is you at the fault, but then you learn how to be, take it on yourself and deal with the team. Sometimes it is somebody else who's making an error, but then you still learn how to deal with it. You cannot blame anybody because it's a team sport. So I think you develop a lot of characteristics in terms of you become a good leader, you become a good person, you know how to deal with a group, you know how to talk to people, you know how to deal with different backgrounds. So I think that's a
Gradually, sportsman spirit is inbuilt into you.
And it helps you in any direction that you're going to go in life. Wherever you go, these qualities will help you grow.
But I want to know what, suppose a parent want to get convinced I should send my children for an academy for football.
Correct.
So don't you think they are planning what will they become? So everybody will not think my son or daughter will be a better human being, or they will have more sportsman spirit. They
Right.
also look at an angle what they will earn, who will give them a job,
Correct.
whether it's paying a game that will pay them well. Because I feel certain games, like if you have to compare between cricket and football, a cricketer, once he plays for the country, it's an industry by himself.
Correct.
The amount that he will earn to advertisement, to the fees, to the league matches that he will be playing,
Yes.
comparing with football.
Correct. So the difference is massive, definitely, and the reason is viewership. So cricket is watched by a lot of people, and that's why there is a lot of money that is rolling in cricket. However, with football, like you said, a lot of parents have that curiosity that what the player will do in a career. Parents have that question that I am putting him. So now, a 8-year-old which is coming to me, and parents want them to become a professional footballer. We cannot tell them that it's a guarantee that he'll become a footballer, but the guarantee is that he'll become a better person for sure. So out of 1,000 people, if we are training, there are about 2 or 3% which will make it to pro, and which is a fact which we tell the parents in the beginning itself. Okay, we have this chat with the parents that we understand that you want them to become a pro player, but there is a good possibility. Now the kids are kids. 8-year-old, maybe he becomes 10 years old and some of his best friends are picking up basketball, is gonna go.
I feel, see, cricket took a flight when we won the 1983 World Cup. Everything changed. Everything became cricket. So don't you think, where do we stand? Forget the World Cup or the world team, as far as Asia is concerned. And I think so 3 or 4 teams from Asia go to the World Cup.
So, sir, we were doing at one point, couple of years ago, we were doing really, really good in terms of Asian football. But since last 2, 3 years, we are struggling in Asian football as well. That has been a concern. The major viewpoint here from my side, this is my perspective, would be that we need to give more opportunity. So, like I said, my team's name is Prodigies. I believe in giving chances to younger people at early stages so that they can develop more and play at the top level even more longer. Okay, but if you see the Indian squad, if you can keep picking the older players who are experienced ones again and again for top league competitions, you are not really giving an opportunity for younger ones to
Youngsters.
develop.
Do you think the parents find it's an injurious game? In football, we have so many knee injuries, the ACL injuries, the meniscus injuries, and that keeps them away, not encouraging the children to take up football.
100%, sir. Yes, that is one of the reasons. Whenever we have trial classes, the parents, they have this question that like cricket is non-contact sport, so it's easier for them where they don't get injury. Really, it's all technical and tactical sport. But then when it comes to football, parents have that query that my kid is going to be in physical contact with this guy. If they get injured, what to do? We have seen so many players drop off because of one small injury in a trial class or in the beginning of the class. So parents gets worried and they don't want to continue. So also they have heard from other, like you said, ACL injuries and all of these injuries. So they have heard from some other people and they question us that what if this happens? So it's part and parcel of the game. There is not much that you can really do apart from making sure that you are training well, you are equipping the player to handle these injuries or make them so fit that they don't get injured so often. That's the only thing that we can do as coaches. But then injuries are part of the game. So
See, I'm in a sports medicine clinic
yes,
at Nanavati.
yeah,
So I would say take you back to 90s, 92, 94.
yes,
If I saw 15 cricketers as a patient in a day, I was seeing maybe 3 or 4 footballer as a patient.
right,
But for the last 2 years, I see the reverse. I'm seeing more footballers as a patient
right,
than a cricketer coming. So that could be two things. Either the youngsters have started gone more towards football,
yes. That is a
cricket
definite
has
change.
reduced, or cricketers are having lesser injuries now and footballers have more injuries.
Yeah, so I think players have started playing football.
Yeah.
Definitely, that's a yes,
There was a
because
movie, for Bend It Like Beckham. After that, many girls started playing football.
that's correct. So yes, after when did like Beckham, they
Yeah.
started playing football, and also the as you see that cricket is also gone shorter. People don't want to spend
That's
5 days watching Test cricket or a 50-over match, so they are opting out for football. Football is a lesser expensive sport in
90
comparison.
minutes.
90 minutes lesser expensive. You
And
can
a result.
and a result.
No
Every
draw.
game gets a result. There very few games have a draw. In league stages, you can have a draw.
But they have the penalty stroke and then
So in league stages, they don't have it, but yes, you generally get a point, and it ends in 90 minutes. So players are opting for that because they have now. If you see the players, they have like very packed schedule.
but
Just to,
finals have to give the result.
finals definitely have semi-finals, finals. Anything that is knockout has to get a result. So yes. So now they are opting for football because it's a shorter format. It's easier to train, easier to go ahead. Because cricket, you cannot. Parents are not okay with investing 5-6 hours of their
Yeah.
day
And
unless they are
costly
very serious.
equipments.
Very expensive. In comparison with football, it's definitely more expensive. When we talk about injuries in football, why they are rising, as you are seeing more patients now, multiple things. One is number of players has increased. Another thing, we have changed in Mumbai because we don't have a lot of infrastructure. We don't have open playgrounds or mud grounds. We have switched to harder surfaces. Now everything has become turf, and then the trainings are happening on turf.
Injury.
Yes, and players are booking smaller turfs at regular basis, which is more of unregulated play where there are no rules, there is nobody to monitor. So this leads to over usage or injuries where there is no, no attention paid, and players are playing constantly. Small twist, turn, wrong landing. If you're not trained very properly, and if you end up in any of these scenarios where you're landing wrong, when you're twisting or turning in a bad scenario where your body was not ready, you end up getting those injuries.
So
So,
we emphasize a lot of warming up.
so
See, the cause of injuries could be if you have not done enough warming up,
right,
then stretching.
right,
So warming up, stretching, and then if you are ready to play. Similarly, after your practice or game,
yes,
the cooling down also should be there to prepare yourself for the next day.
correct,
So that has to become part of any sports.
yeah. So yes, we focus on warm up, sir. So now with I will talk about my Premier League teams. Okay, we focus a lot on good warm up. We have strength and conditioning coaches who do speed work with these athletes for a couple of at least once a week. We do that. They have good warm up. They do good cool down also. But then those injuries they still come up, sir. I would like to take
But
a
injuries are part of sports. You
yeah.
can't say I will play sports and not to be injured. So I feel part and parcel of any sports are injuries.
That's true. But then, sir, is there any way that you think that because we are doing strength and conditioning work, players are going to the gym, where we are balancing it out that you don't have to be very bulky. You should not have dead weight on you while playing football. You are training speed because it's extremely dynamic. It's not only strength, it's not only speed. It's about 90 minutes constant movement. There is somebody who's pressing against you throughout the game. You have to take that weight and move, and all of these things have been worked on, but still there are basic injuries. Is there any input from your side that you can suggest that we should do better, avoid these injuries? Is there anything
To
you can suggest?
prevent one, I said a good warm up, good stretching. And stretching, I mean footballers, good stretching of hamstring muscle,
Okay,
calf,
correct.
quadriceps,
Yeah.
right? Good mobility at the hip level because you're running.
Yes.
Overall mobility, so you could give a header.
Yeah.
So you requires a lot of stretching and mobility exercises there. And if injured, injury can happen. You have a blunt injury someday hitting.
Yeah.
So I would say, like immediately the treatment should be ice, lot of ice.
Okay.
But we are not allowed to go to the ground. The rule will say you
Yes.
can go in, identify the problem, and the player has to come out for treatment.
Correct.
So once he's out for treatment, how important the player is, how fast. So definitely, I would use the fast relief spray.
Yes. Correct, sir.
But giving ice, it's going to take you 10 minutes.
It's
So
ice
10
and
minutes, your player is out.
but then as a coach, I would be nagging my physio. That happens with us a lot of times. So they want to put ice. A lot of times physios tell us that get this player out. But then I think that's not very ideal for the game scenario. If the player is really important, we want them to go back in. Then I think we tell them, we sign from here that just spray him,
Yeah,
let him go back in, because
allow him to.
yeah.
We'll see at
So
the end of the game.
yes, so we don't want to look really shrewd on the to other players also, but then at the same time, players also understand.
But then this was not there. Like if you go back 20 years back, all these facilities were not there. We had to rely patient coming out, the player coming out, then you will apply ice and somebody else replaces him. So you have lost. But definitely there are so many other things that has come. The creams have come, the sprays have come, which you
Yes.
immediately do it, and you can put back the player on the ground immediately.
Correct, and that has been very helpful for us, sir. So, getting very important. So, if the player is not so important, and if the injury is major, so with me, in my case, if the player is very young, and if the injury looks that it might injure the player more, we pull them out. If it is a senior player who can handle it, who understands the tempo of the game, who can manage it better, we allow those players to go back in. But if it is a young player, we have to pull them out because we cannot give them a long sustained chronic injury. So we avoid it with young players, but then with the senior players, spray does the job.
But being a coach, if you see them when they have started the game again, the way they are running, the way they are moving with the ball will immediately tell you whether he's playing with his 100% fitness.
That's correct, sir. That's correct.
So
So
you can then pull them out if you feel he's not running well.
yes. So we observe. So that's what we do. Like you
Yes.
said, once they go back in, we observe for a couple of minutes how they are feeling. We check with them once again that, are you okay? Is it good to go? So in this also, there are few players who will be feeling that resistance, who will be feeling that there is pain. But then in their head, if they are into the game and the team is losing or they want to fight more, they want something to be done for the team, they'll push really, really hard.
See, any player should understand that pain is a signal that something is wrong somewhere.
Correct.
It's like thirst. When
Yeah.
you are thirsty, when you feel the body requires fluid,
Right.
so the body sends you a sign you are thirsty. So you will take fluid.
Right.
So always take pain as a signal that something is wrong somewhere. Try to find out what it is. I've seen footballers continuing playing. Suppose they had an initial injury at the ACL level.
Yeah.
The ball was blocked, or with the rotation of the knee, with the knee bend and rotation.
Yeah.
So there are chances of ACL or meniscus tear.
Right.
Now, if you continue, then it can be locking. It could be complete tear of ACL, and complete tear of ACL means reconstruction of ACL through arthroscopy, and not before 4 months the player is back in the
Back
game.
on the field.
So it goes out for 4 months.
Correct.
But if it's only meniscus, definitely in 2 to 3 weeks the player can start playing again.
Okay.
So the injuries also are such which are identified. But a hamstring pull maybe a week,
Okay.
right? So, but if the player has stretched well, should not get hamstring.
Yes.
So usually I see players who have not done. When you ask them later on, they had not done. They were not serious about the stretching exercises.
Correct. I have seen this one also, sir, that the lazy players or the ones who will avoid the warm-ups,
Stretching and
they might end up getting injured. So what we try to do, we try to do at least 100% sprint before the game, just before the game starts, so they are ready with after the full warm-up.
Come to know.
After the full warm-up, at least one sprint where they are going 100% effort, and then we can see that if they are ready or no. But at times there are players who smartly will avoid your eye and get into a scenario where they might pull their hamstrings.
I had a PhD student. One of our students did PhD on football players.
Okay.
So we had taken 8 football teams.
Yeah.
So very important part which all sportsmen should check is the vitamin B12 and vitamin D3. Most of the Indians have deficiency in it.
Yes.
And we saw in all the 8 football team, into 25 player each team,
Okay.
there was deficiency of B12 or D3. Majority of them both.
Yes.
So before that, we had done a test on them, just kicking the ball, spot standing and just hitting the football. We saw through the gun, we measured how many minutes it took or seconds it took to travel and how many meters it traveled.
Right.
Then taking a start and kicking the ball, we again saw how much it traveled, 70 meters, 80 meters.
Okay.
And we checked that also. And then we did the blood test when it was deficit. We had the fastest way to get it back through injection of vitamin D3, B12.
Okay.
After 72 hours, we asked them to do all the tests again.
Okay.
They could hit more, the ball traveled more in a shorter time.
Within 72 hours, you're saying that.
Injection, it should, D3, B12 should go up.
Wow.
And there's a test called vital capacity. We see the lung capacity.
Okay.
So suppose it was 3 liters of footballers.
Yeah.
But after giving them the vitamin D3 and B12, the vital capacity increased by half a liter.
No, that's really, really great insight, sir.
So please check with all your team players
We have done that, sir, and like you said, B12 and D3 is very commonly low in all
Low,
the
yeah.
players.
Yes.
But I had no idea that, if we give them the injections
Even
or if
vital
they
capacity
get it back,
increases.
it will increase. So, because at the end of the game that I see there is fatigue that kicks in into these players, the ones who have B12 and D3 low. So I think I'll suggest to
Yes,
them
and
that, they
magnesium.
can maybe
I should add.
go for
I put
this.
magnesium. I tell them to buy Epsom salt. Put it in half a bucket of water. You can put it in the dressing room.
Right.
You will have the eye scan, which is laid there. If you put magnesium,
Yeah.
Epsom salt in it,
Correct.
if the players after the game dip the leg in it, the recovery is faster.
Oh,
Or even that 15 minutes break that you have, even for 5 minutes, if they dip the leg in Epsom salt,
yeah.
so it increases the magnesium.
So,
Magnesium takes care of the pain and
okay.
increases your B12 and D3 if taken.
Okay, understood, sir. So now I just wanted to understand, like you said, Epsom salt. Should it be added in ice water or regular water?
Regular, any
Regular water
water.
is
Even
okay.
warm water. Evening, if you're doing it
Yeah,
in a lukewarm water, if you have a mug of Epsom salt,
yeah,
the sleep will be better, the fatigue pain will go away,
correct.
they
As
will
a coach,
have
I would
better
like to know
relax.
what should I do in the middle of the game. Let's say halftime. What should I do? Should I use
If they come just for 15 minutes, they hardly have 5 to 7 minutes. They can dip the leg even in chilled water
chilled
with
water?
Epsom
Okay,
salt.
okay. So that's good. So after every game, we try to do an ice bath with all these players. So they go for ice
But
bath.
add Epsom
So we'll
salt now.
add Epsom salt now because
That
that will
is,
be
they
helpful.
will increase the magnesium.
Yes.
Before putting your players in,
Yeah.
what is your criteria knowing that they are 100% fit or they are in the peak performance? What do you look at?
So multiple things, sir. First is technical ability of the player. Definitely technical ability, tactical understanding, which is not part of the fitness, but then their understanding of football. After that, we come to definitely. So first 11 has to be really, really fit because I don't intend to change them at least for 70, 75 minutes. They need to push through for 70, 75 minutes at high intensity. So during the trainings, we regulate the trainings accordingly. We make sure that the trainings are high intense and the intensity is up towards the match level or even more, and we can give them more breaks. So we try to keep the intensity up. But when it comes to football, it's not only sprints that you can talk about. So it's aerobic, anaerobic. We want them to be like endurance athletes also, but then at the same time very explosive at the same time. Should be very strong to. There is a 90-kilogram defender who's coming and pushing you. You need to be very strong to have that strong base. So we see that which players are able to deal more of these actions throughout the time instead of only who has more tactical and technical decisions of.
But I would like to see the position they play.
Right.
See, giving example of a goalkeeper, he's
Yeah.
within the 20 meters going to catch the ball.
Correct.
But a striker or right out
Right.
is chasing a ball for 70, 80 meters and
Right.
suddenly the ball is kicked back. So he comes back to take the ball, again he's going back. So the endurance that he requires is different. And the
Yes.
guy who's playing the back, again he's within that 40 meters, he's running and passing the ball forward. So there is a general training, we call it,
Yes.
general warming up, general training.
Yes.
Then it should be position wise, which position they play.
Got it.
Like I want the frontline players to do more of dash of 40 meters and 60 meters because that's what they try to reach the ball.
Correct.
And more flexibility with the goalkeeper because he has to jump any side.
That's correct, sir. So yes, we look for that one aspect, and that is like you rightly said that different positions has different requirements,
Yes.
and we want to see if they're doing that or not. Like you mentioned, the wingers or the strikers, they need to do those sprints a lot. They'll have to contest with an opponent which is going to
Yep.
run toe
Yeah.
to toe with them. So it will have to be explosive. At the same time, they'll have to have good structure, strength to push away the defender and get through. Whereas if they lose the ball, they'll have to come back again.
Yes.
So
Yeah.
endurance has to be up. They may do lesser number of sprints, but then they'll have to do it at full speed. Whereas a midfielder does not have to do 100% full speed so often, but then they'll have to be physically very, very strong.
This is the feeder. He immediately feeds forward.
Correct. So he'll have to be physically strong to turn, make the passes, have a good vision. He should be somebody who's mentally very, very strong, who listens to a lot of things and processes information faster even during such a tight situation. For a centre back, the defenders, we want them to jump high, get the headers, win the headers, and get the ball out. So yes, different positions, different requirements is necessary, and we look at those smaller aspects apart from technical, tactical abilities, and like I said, the fitness, the regular fitness also general. But then yes, this specific fitness is needed, and you may not see coaches talking about it very often, but at the back of our mind, we keep
It
making
keeps,
notes of these things. I don't know, this
yes,
player does this very quickly, so yes, that is necessary for us for sure.
great.
So I wanted to understand from your point of view, sir. Now I see that a lot of players, like I said, we do technical, tactical trainings, we do this fitness, we do endurance training, we do speed work also. After that, if a player gets injured, goes into a rehab for a very long time. Some players, they do not need a long rehab. They come back very, very fast. They do everything good, but then you know how do we know that the player is ready? Because some players mentally they tell you that they are ready, and then they end up getting injured again. Some players feel that they are not ready, but actually if you see physical parameters, they are completely ready, but then they are not coming back. So can
It
you
all
help me
depends
with
on the
this?
mental conditioning.
Okay.
So, once a patient is injured, the injuries have a timeline.
Yeah.
So, if it is a meniscus injury and they go for an arthroscopy,
Yeah.
and after the repair or sucking out the torn part,
Yeah.
so I feel 2 to 3 weeks is good enough for them to come back. But if it's an ACL tear reconstructed,
Yes.
3 months to 4 months will be the required time.
Right.
So some players with small injuries that you feel they are not coming back or they are not prepared,
Yes.
definitely they have gone in depression.
Okay. So
So keeping the mental conditioning in mind, you should have an expert to find out whether the patient has gone in depression. So my question usually to the players are,
yes.
after the injury or during the rehab, how well you sleep.
Okay.
If they say they have a disturbed sleep, they can't sleep in time, they
Right.
don't get sleep,
Yes.
or they get up in between,
Right.
they should definitely see a psychiatrist or a sports psychologist to
Okay.
help them out. This is the first sign.
So
If you
is this a
have
first
got
sign of
this sign,
depression or
yeah,
anxiety, something of that sort?
yeah. So
Okay.
that's a sign.
Okay.
Sleep is very important. So
Okay.
I feel if the sportsman really wants to do well, also my one-liner would be increase your sleep.
Okay.
If they're sleeping 6 hours, they make it 7. If it is 7, make it 8. And if they say they're sleeping for 8 hours, make it 9.
Okay.
Increase your sleep, you will play better.
Understood, sir.
I'll put it like that in a simpler way. 8 hours, if you divide the day into 3 8s,
Right.
8 is sleep,
Right.
8 hours. 8 hours is work,
Huh.
right? If they are practicing, it has to be in that 8 hours and they're
Correct.
not working.
Right.
The third 8 hours, how they will use it is important.
Right.
You may use the third 8 hours in traveling,
Okay.
meeting your friends, doing your other work that you have to do, your social work, meeting people, greeting people, uh, doing some job left,
Yeah.
reading. If you are a player, reading more about it, watching some games.
Right.
So that if you divide your day into 3 8s, so part of
Correct.
it is some concentrating on your soccer or football, watching some good matches every day,
Right.
which they will learn a lot from that match. So mentally they have to become strong. So becoming the mental strength will come with better games, better
Yes.
looking.
Yeah, so while you are saying that, I think that's a major concern. Those 8 hours, I think, is a concern here because the players, 8 hours maybe in a school, college, or job, then they do 2 hours of training, and then after remaining 2 hours of training, and the remaining 6 hours are possibly they are not dedicated to recover, they're not dedicated to watch the games or improve themselves. It's going to be, unless you are in a residential academy, you are in a professional setup, you can do that. But if you are at in Mumbai, you are
Home, you have
going
too
back
many
home,
things to do.
then yes, your mom has something for you to work
Yes.
on. Maybe you have a girlfriend who needs your time. So all of these are major concerns that we
Please
face.
give them 1 day complete rest in a week. I
Okay.
advise all sportsmen.
So by one day you say 24 hours, is it?
Yes. And I put it in that way.
Okay.
कि when I say rest,
Okay.
it means having breakfast, lunch, and dinner on bed,
Okay. So like
doing nothing.
doing nothing
But
at all.
people rest day, they are playing in the building, they're playing in the gully,
Right.
they are shooting for some shows or the
Right.
advertisement.
Yeah.
They go and meet their friends and parents, traveling.
So you are
So,
saying none of it.
none.
So physical rest.
The
It's
body has
need
to
not be.
recover after 6 days.
Okay.
1 day complete rest
Okay.
and you are a better player from the next day.
Okay. I think this is going to be a difficult one for me to explain and get it out of the players. But there will be a certain percentage of player who will actually try to do it.
You have to tell
And
them.
if it shows up, then it
The
might be
rest
a
will follow.
moment, yes, everybody can follow.
So the best thing is, if you take a test on your players, the speed of running, there are guns available which show the speed of running.
Correct.
Kicking the ball from the spot and running and kicking, how much the ball travels. So that should be your fitness test.
Okay.
Okay, when they come back to that, or if they are better at it, they are better. If they can't, say you could hit a ball which was going 100 meters,
Right.
but now it is going 80 meters. So what is wrong?
Correct.
So you have to derive a parameter. Has to do with cricket, making them run between the wicket
Okay.
for 1 minute.
Okay.
So
And
I
this
knew he
is
could do 14 runs in a minute.
this
But
is
now when he,
pre-injury. This is
yeah,
before
pre
regular
at
regular
peak fitness.
peak fitness. Okay.
So whenever you have player as a peak fitness, there are 2-3 points that you have to see.
Okay.
If he could jump,
Right.
right, horizontal jump,
Yeah.
kicking the ball, how much the ball traveled,
Right.
right? Maybe 80 meters, 100 meters, 120 meters.
Correct.
So when you want to do a fitness test, just keep the ball, ask him to kick.
Okay.
So whether it travels more, he is better.
Right.
But if it travels half the thing, something is wrong.
Is not correct. So this can be a good parameter for me
Yeah.
actually, where I can either the ones who are telling me they are ready but not, I can tell them that you are not because you are not at your peak
Yes.
fitness level. The ones who are physically ready, mentally not, I can tell them that you need a mental coach because you are
Yes.
performing better or equal of your peak fitness. So now you should definitely sit with the mental coach. That's a really good point for that is going to help me, sir. There has been my experience with multiple tournaments. Recently in district tournament also, this happens a lot of times that physios have a say that you should not be doing certain thing or take the player out. He is not ready to play. Whereas the player is really important for me, and there has been so many times that we do not align. So, have you come across such things?
Many, many instances.
Yeah.
One, it depends the importance of that game,
Right.
importance of that position the player is playing,
Right.
whether you will find the next replacement.
Yeah.
So I'll give you an example of a World Cup where our senior most player, opener of our team, had 102 degrees fever,
Right.
and the captain wanted that he should play. The
Okay.
replacement was a 12th person who would come in and play his first match.
Okay.
And the person with 102 fever was an experience.
Right.
So the captain demanded that he has to play.
100% as
So
a
we
coach.
got the physician in, see what all could be given, told him how important he is for the game.
Right.
And I remember that captain even said, even if he's 50% fit, I want him to play. And we saw that he played, and he made a century. We won the game.
So, sir, a lot of times on sidelines, I see that an important player has got a knock or a little bit of a sprain. They're taken out, and the physios are not sure what to. I mean, should they sub them out? But then it's an important player. What do you think we should do in that case?
There's not enough time for applying ice and waiting for it.
Correct.
I would use a Zandu fast relief spray.
Okay. That's a really good idea, sir. I think we'll do that.
Thank you.
Thank you.
But I want to wish your team all the best. Look
Thank
forward that you keep growing,
Thank you so
come
much,
to
sir.
higher leagues, and produce players for India also.
I'll try my best to do that, sir.